Hi, so my name is Rosie Strouse, and I'm a physical therapist here at Core 3, and I am McKenzie certified, and this is Jackie. She is a PT student, and she is soon to be PT in like 3 weeks, so we're super excited for her. So at Penridge Wellness Center, you guys utilize McKenzie-based exercises during certain phases of your treatment. So in this video, we're going to be teaching you how to do these certain McKenzie exercises in the correct way. Also, so you guys know that McKenzie-based exercises can be done in different planes. The ones that you utilize at Penridge Wellness Center are mostly done in the sagittal plane, trying to facilitate extension so that we can maintain the natural curve of our spine the way it's supposed to be shaped. So the first thing that we're going to focus on are our neck-based exercises. The most important thing is that you set yourself up appropriately. So Jackie is sitting in this chair here, and in this position, we actually want to optimize her, the way she's sitting better. So you would utilize a lumbar roll or a rolled up towel that can be in this shape. So what I'll do is have Jackie sit all the way back in her chair with her hips. Good, and then she's gonna lean forward for me, and I'm gonna press this down right to where her belt line would be, and then she comes right back up. So as you can see now, Jackie is sitting in a more upright position, which is going to help us when we do our exercises to more optimize the effectiveness of them and also help the natural curve better. So from here, we're going to first teach you a cervical retraction. So a cervical retraction is done when the patient pulls their chin straight back, good, and then relax. So at this point, we're not going to be using our hand. We're just going to be doing our own active movement. So Jackie pulls her chin straight back and then relax. As you can see, Jackie's not tucking her head down and she's not bringing her head up. She's pretending it is right on a flat surface as she drives her chin backwards towards, and then back down. Good. So the next step would be, if you're doing a cervical retraction well, then we can have you do it with your own self-overpressure. So Jackie's going to show you, she's going to pull her chin back actively on her own and then give herself some pressure with her hand on the front of her chin. And what is important is that Jackie's not just pressing with her hand because that's very uncomfortable. We have to make sure she does her own active movement first and then press on her chin just to get a little extra pressure. So that is the next step after that. Once you've mastered a cervical retraction with self-overpressure, then you might be introduced to the exercise called cervical retraction extension. So with this one, it's going to be, again, your own active movement. So Jackie retracts back, and then she extends her head all the way back to her end range, and then she comes back in that retracted position and relaxes. The important thing, Jackie did this perfectly, but sometimes people will retract back like this, and then when they go into extension, they push their chin back forward to go back. That is not going to optimize the normal natural curve of our cervical spine. So it's important that Jackie retracts fully back and then lets her head fall into end range extension, and then she comes back in that retracted position. Perfect. So once you have mastered that, you can go into cervical retraction extension with overpressure, which is similar to the one we showed you. So Jackie's gonna push her chin back with her own active movement, give herself some pressure, and then guide herself back into extension as far as she can, and then comes back in and relaxes. Perfect. So the last progression of this exercise, which actually gets us to get to our end range most optimally, is called cervical retraction with oscillatory rotation at end range, or otherwise called cervical retraction extension with wiggle. So you're going to go back and retract your chin, perfect, and then you're going to extend all the way back, and then she's going to gently rotate her chin side to side and pressing herself more into extension, good, and then from there she comes back into retraction. So with that one, you don't want to hang out in extension too long. You only want to rotate 4 to 5 times, and then you're going to come back up into that retracted position. Okay, so that is all the exercise that you guys perform for the cervical spine, but so you guys know there are other McKenzie-based exercises that you can perform, and if these ones aren't working optimally for you, it might be good to go see a McKenzie certified therapist to help you through those other planes of movement that you might need to introduce. Our next exercise that you guys use at Penridge Wellness is called a prone press up, and this is for your lumbar spine. So we're gonna move this out of the way. And Jackie's gonna actually be laying on the table. Perfect. And she's gonna be laying on her stomach. So her hands are gonna be placed directly under her shoulders, which is where she's at right now. And her feet are gonna, and her glutes are all gonna be relaxed. Everything in her legs are relaxed. She's going to press up, getting her arms all the way locked out straight, and then she slowly comes back down. Now, everyone's not going to be as flexible, but the idea is that you do not need to keep your hips on the table. The idea is that you want to get your arms all the way straight and then keep your hips sunken down towards the table, but they don't need to remain flat on the table. So after you've mastered this, the next step would be that Jackie would do self-overpressure, and that's with breath. So she's going to inhale on the way up. So you inhale all the way, and then at the top, she's going to exhale. Good, and then come back down. Take note that Jackie gets a bigger hip sink when she exhales. So she's going to do that one more time. She's going to come up, good, and then exhale. Awesome, and then come back down. So the important thing with the exhale, she gets more optimal extension that way, but she's also able to relax her legs and her back musculature better with the breathing out technique, which is our self-overpressure. You can go ahead and come on up. So all of these, just like the neck, we have exercises for the lumbar spine in different planes of movement. So if you're not responding to this press up the way that you would expect to, or it's causing more pain, you may need to seek treatment from a McKenzie certified therapist to go through other planes of movement, just like the cervical spine. The important thing is that you are doing these exercises with intent. So the goal is to get to your end range. And in McKenzie-based treatment, they always say that the magic happens at end range. So if you're not getting there, you have to continuously work on that exercise until you get to your end range for optimal effectiveness of that exercise. So one thing that everyone should take note of with these exercises specifically, what we are looking for is that your pain centralizes. So what centralization means is that your pain is now coming from either the extremity back into the center of your neck, or if it wasn't in your extremity before, then if it was off to one side, we expect it to go into the center of your spine and then go away. So if these exercises are creating pain that is traveling down further away from your spine, then that is not the exercise for you. We are trying to find the exercise that brings it up through your arm and back into the neck. Same thing goes for your lumbar spine. So if you're experiencing any pain in your hip down to your leg or foot, and these exercises are making that pain worse, then that is not the exercise for you. We want the pain to come out of your foot, up into your back, into the center of your back, and then that's when it will more optimally go away. If you guys have any further questions about our McKenzie-based treatment or our McKenzie exercises, you can contact us at Core 3 Physical Therapy in our Hatfield or East Norriton location. All of our information's on our website. And then also, good luck with your treatment.